Hi, Oluchi here, Medications Part 4. I'll be talking about insulin today. Insulin is a very sensitive medication. It is sensitive in that it has a propensity to cause harm to the patient. It has side effects that could pose danger to the patient. There are two things that you should take note of when you are giving insulin. The first one is that there should be another nurse to verify the dose, the routes, the patient, all those criteria to make sure you are giving the correct thing to the correct patient. So that is one. Number two, when you give insulin, you watch out for the side effects so that if there's anything that is going wrong, it can be taken care of immediately. The good thing with insulin orders is that it comes in a set. What I mean is that there is a set of instructions of what to do if anything goes wrong. For instance, if you give insulin and the patient goes into hypoglycemia, there are instructions attached to the original order on what you should do immediately to salvage the situation. There are four kinds of insulin. There's the rapid-acting insulin, there's a short-acting, intermediate-acting, and long-acting insulin. Under these categories, there are also different types. I'm going to just mention in passing the most common ones. For the rapid-acting insulin, the most common one is Lispro. The trade name is Humalog. For short-acting insulin, regular insulin, that's human insulin. The trade name is Humulin R. Then for intermediate acting insulin is MPH. Trade name is Humulin N. Then for the long acting insulin, the most common one I see is Glargine. And the trade name for that one is Lantus. So like I said, when you are giving insulin, you watch out for the side effects, especially the rapid-acting insulin, Lispro, that carries the highest risk of hypoglycemia. So when you are giving it, make sure the patient has eaten something within 15 minutes, of giving it. Then another thing is you will be prepared. Of course, there's another side that tells you what to do about if the patient goes into hypoglycemia. I already talked about that. Then a quick tip, usually when depending on the condition of the patient, the order to treat hypoglycemia could be to give a glucose containing drink, PO, to give glucagon IM, and then to give 50% dextrose IV. So a quick tip on giving glucagon, if maybe that's what the patient is getting because of the circumstances surrounding the patient. Some patients may not be able to take anything PO and they may not have an IV. So that's when you go with glucagon. So a quick tip on giving glucagon is that it slows down gastric motility, so it makes the patient prone to vomit. So when you give glucagon, make sure you position the patient in such a way that if the patient on the side and with a slight head tilt, so that when the patient vomits, the vomiters comes out by gravity rather than going inside and then posing a risk of aspiration. So that's one thing with giving glucagon. Now let's go over the syringes for insulin. This one right here is calibrated in units and is 50 units. This one is calibrated in units, is 100 units. And this one is calibrated in mils. They call it mls here, or cc, but I'm used to calling it mils. So of these three syringes, my favorite is this one in 50 units, because insulin is prescribed in units. So when you get this syringe, all you have to do, if it's 2 units, you get 2 units. You don't need to convert it to mils to say, okay, say 2 units is equal to so mils. Even though Some of the dispensers, the medication dispensers, will convert it for you. It will show that 1 unit is equals to so mils, and it's usually in fractions. So I prefer to use these ones that will give me the straight up dose. I'll draw it and give it to the patient. So that's why I prefer to use this one in units rather than the one in mils. Next video, I'll be talking about heparin. Make sure to like, share, subscribe, and follow for more. Thank you for listening.